Hey, welcome back to the pod. This is Steven, the host of this podcast. And you know what? I'm doing it. I'm calling it the poop. And we actually have one of my best friends. We have one of my best friends in the podcast room today. His name is Matthew Spencer. He is part of the leadership team of Grand Mental Help. He is Chief Clinical Officer.
Yeah, Chief Clinical Officer of the 12 counties that surround Tulsa.
Okay, cool. Yeah, we're going to talk more about that here in a second. But so it's funny that we kind of lead off this episode talking about that. You were the first person that I asked about the poop podcast, which I think it's just the perfect fitting that it's this episode that I'm going to announce. We are officially calling it the poop podcast. Now, tell me.
What was my suggestion?
You said do it.
No, I said absolutely not. That's not the right name. Oh, so listen, if it takes off and that's the name, then it's all on me, man. I made a mistake, right? But I just, for the record, pointed out that.
Well, I thought I've been telling everybody there's been one person that loves it, and I thought it was you.
No,
but it wasn't.
It wasn't me.
Okay,
it wasn't me. No.
Well, that's news to me. But hey, welcome to the Poop Podcast.
All right, I'm here. I've arrived.
Matthew Spencer in the house. So we actually have a really cool way we kind of met. So I'm a part of the church. A couple of episodes ago, if you've watched, we had Scott Carlson on, which is the pastor of the Refuge. And that's how me and Matt actually met. So if you watch that podcast, there was a story of me getting in front of the church and crying and basically saying, I'm an alcoholic and I, relapsed and, I need prayer and things. And Matthew and his wife, Haley, actually approached me and my wife afterwards. I mean, we kind of knew of each other, but didn't have a really close relationship. Just kind of like probably those average church relationships where you don't really get too deep with the next person. But you and your wife asked us out to dinner or lunch after church.
Well, Haley told me, she said, we're going to go to lunch with them after you guys got up and you were crying. I was like, Haley, I'm pretty sure everybody wants to go to lunch with them. I don't know that we're going to be privileged enough to. She's like, no, just trust me. She went over to Taylor right afterwards and came back. She's like, we're going to lunch with them.
Yeah, no one else asked. I think everybody else was like, well, that was too deep.
No, I was like, man, You even said afterwards, you started getting all the food brought to you,
we got food brought to us, but no one, I think everybody just wanted to stay their distance and be like, hey, we'll bring food to you so we can leave.
Okay.
You were the only one that was brave enough to say, all right, this is raw. We got to take them out to lunch now.
Yeah.
But no, we got a lot of great, because that's what one great thing about being part of a church is, women cook for you and bring you food and families. And yeah, it's great. We got a lot of chicken spaghetti that week. Lot.
I thought it was a really cool lunch.
I was super hungover.
You were not feeling good.
No, I was super hungover.
Taylor's like trying to keep it together. Everything. Haley and I are like, do we ask questions? Do we not ask questions? That type of thing. But it worked out. We just flowed. Like we just got along, and I think our whole thing, like, we didn't have an agenda or anything. We just wanted to be there with you guys and just get something to eat, break bread, and
that was probably one of the most awkward lunches I've ever been to. To be honest,
you just wanted to go home, right?
I wanted to go home as fast as possible.
You just had this catharsis in front of like 100 people or however many
I don't even
were
think,
there that day.
I think when I got up on the whatever stage or whatever you want to call it in front of the congregation, I think I said, I'm an alcoholic, and just started crying. And then every other word was like, and then Scott, I think, eventually stopped me and just like, hey, just come here, son. And then everyone got up and gave me a hug. And then, an hour or, 30 minutes later, I was at Slim Chickens eating chicken.
It's good for the soul, right?
Yeah. Good for soul. But no, that was that was really important in our lives that you and Haley did that, because from that, Haley, Elena, Kara, all that. that group there. That's some of Taylor's best friends that pretty much saved my marriage. Probably.
It's really
not probably. It did.
Right. And really,
that relationship.
Really good friends. Great but friends. I think beyond that too, like, it actually helped the church, because we're in a very young church, like startup. We didn't even have a building at the time. Right. And, so it was just it was one of those things where whenever someone's real and they're vulnerable and they put their issues out there, like, that's how you get to, that's how you get to the good stuff. Like that's how you heal. And so I just think it was really cool that that you were able to let that out.
Mm-hmm.
And it took a lot of bravery, and I had a lot of respect for it. And I think you helped our church a lot, you know,
thank
and
you.
You still do.
Yeah. And that's actually, I mean, that makes me feel really good you said that, because that's exactly what Scott said. Even though I kind of make light of the situation, because that's just who I am. I don't like being serious about too many things, but you know, there's obviously a time and place to be serious about things. And so he said that, and just makes me feel really good, because I mean, that was a very nervous. I mean, I don't think anybody wants to be in front of a church and kind of admit what they did. But you deal with that all the time of being a therapist.
Yes.
And that's why I wanted to have you on, talking about, obviously talking about that and some other things. But going back real quick, of us becoming friends, because I think this is another really interesting thing about our relationship is we're workout partners. So
yes.
We work out every morning at 5 a.m. at 10 Gym. Shout out 10 Gym in Owasso.
Shout out.
Also shout out to our sauna buddies.
Yeah. We don't know your names, but
we don't.
You're good friends.
Yes.
You keep us through the sauna. The original 10 minutes that we feel confident in getting whenever we walk in there, we walk out 20 minutes later, and we've sweat better because of you. So shout out sauna buddies.
And that's actually the reason why I kind of started the podcast. That was one of the reasons, is because when we have that
sauna buddies, was the reason?
Yeah, because we would have such good conversations in there.
It's true.
And I think it would just be really inappropriate to record something in a sauna.
Oh, of course. Yeah. Yeah.
Okay, good. All right. I was just making sure.
Yeah.
Sometimes I jump over the line.
Well, it's just because the phone would die, right? Like as you're filming, or the camera.
That is
it
true.
It just gets too hot.
It gets too hot.
That's the obvious reason you wouldn't do it.
Which is also the worst, because when that happens and you have the timer on your phone, you're like, well, crap, how long have I been in here? But seriously, the reason is because we had great conversations in there, and it ain't like bad, or, fast forward the time, because you get distracted, and then all of a sudden you're at like 21 minutes and you're like, yes, I made it, get out. Because it just gets so hot. But also, we became, friends, working out together and just, keeping each other accountable. But also I think there's another cool dynamic to our relationship that I would consider myself as more conservative.
Sure.
And you would probably consider yourself more on the liberal, mindset or views.
Yeah.
So it's really interesting and really cool that we bring different viewpoints or have different opinions on things. But I mean, honestly, you changed my mind on some things. I think I have not changed your mind at all about any viewpoints.
That's not true.
So you're very closed-minded, and that's the reason why I brought you on the pod, is to
I'm going to open your mind.
I'm going to open your mind
to the conservative ideology.
And I'm going to get you to vote for Trump this year.
Oh, that's not going to happen.
I'm just kidding. But no, so I think that's really cool. And I think honestly, I think that's what the nation's really lacking, is just people having just like I don't want to say honest, but just like open conversations, and not like, judging people or like saying your views are wrong or my views are right. Just like listening and talking. So
absolutely. It's views. It's a personal opinion on what you feel would work out best for the country or for your city or your state,
Yeah.
And that's what it boils down to, is you just have to have respect for the other person. And we've never gotten into it, never argued anything out. We know kind of where each other stands, and it's never bothered me.
Yeah. Yeah. And I mean, to be on the real, I've always asked the questions.
That's true.
So I'm like, Matt, what do you think about this? And then
I think I'm kind of the one that's surrounded, right? Like, we live in Oklahoma. It's considered to be a very conservative. I believe every county voted one way in the previous election, and so
what election was that?
2020.
2020.
Yeah.
Okay.
I don't remember who won.
No, you don't remember who won. Okay. Yeah, but we all voted for, definitely vote for Donald Trump. But yeah, I mean, it's very a conservative state. Right. And that's why because I have a YouTube channel, whatever, moving people here to Oklahoma, and that's probably the biggest thing that people say they want to move here to Oklahoma is being, more of a red state, more conservative state. Well, which once again, you have that right to move to whatever state, whatever, if you want to move to Oklahoma because it's more conservative, power to you. But you being, a Democrat and being liberal, how is that like living in a state that's more conservative?
Well, so just to kind of give a little bit of background, I grew up in a conservative home.
Kim and Alan.
The parents are very conservative. So I grew up in that home. I actually, as late as high school, was in would consider myself to be, I think I viewed myself more independent towards them, but more like right leaning in a lot of my ideology, but I think that the interesting, so, that background gives me the ability to, like, I know the framework, like I understand the thought process about it. Like Oklahoma itself is a very like tight knit, like we have to take care of ourselves, right? So there's not as many resources as there are in other states. And so I don't think that people get to take advantage of some of the other like statewide or national programs that other places have. And so I think it's very natural for people to say, listen, I'm not reaping the benefit necessarily of where this tax money is going or what these other programs are doing. And so I think it's very easy for someone to be in that conservative mindset because for a lot of people, that $150 from their paycheck hurts a lot, And so I think that there's a lot of people that that are in a place where they haven't necessarily seen the benefit. And so I've been in that thought process. I've been in the no one's going to raid my coffers mindset. I've been in the mindset of like, I don't want the government dictating what I'm doing here and there, and I didn't have a lot of optimism for what the government was capable.
Right.
Until I found out, the field that I was going into and learned a little bit more about the power of being able to utilize different government programs to get people resources that they need.
Yeah. So would you say you got bit by the liberal bug in college? Is that when you probably your mindset, your views started to change?
If we're being honest, I got bit by it a little bit in high school. So
did you? Okay.
I started realizing, I think the election with Bush and Kerry, I think, was that what
was that? Who was before Obama and Mitt Romney?
It was before. It was before Bush that. So I was really, it was right before I could vote, I believe.
Right.
And so if I had been able to vote in that election, I would have voted for Bush. And I just remember kind of during that election, kind of looking into some of the platforms and looking at what had been accomplished so far, and kind of thinking like, oh man, maybe it would be kind of good to have a different line of thinking in the office. So I had already started kind of heading that direction. I think that college is good for that because you learn a lot more about yourself. You get away from your parents, the roof that you're under, the ideology that was kind of built into you from a young age, and just really give you the ability to really figure it out on your own. And that's what I kind of figured it out on my own,
Yeah. And so when you went to college, did you always want to be a therapist, or did you always want to go into that field?
Yeah. So I went to college thinking I was going to be a big bad doctor. Right. So I
didn't know that.
Interesting. Right.
Yeah.
So I went, the first couple of years that I was there, I was majoring in physiology.
Okay.
And I hated it.
And you're like, this sucks.
I couldn't stand it. Like all these classes, learning about microorganisms, the zoology courses where I'm learning interesting facts about deers and stuff like that. Like I really, I couldn't stand it. Like the least favorite thing that I had about college was the actual college. So the getting off on my own, getting out of the home, getting to meet new people. I loved that part of it, right?
Right.
But the piece that I disliked was the actual learning. And so I had a grandmother at the time who was going through, she had Alzheimer's, and she passed away.
Sorry to.
And I really, I wanted to do something in that realm, and I took a class. It was a psychology of memory class. It was just kind of like this extra. It counted for something towards the physiology degree that I was going into. And I found out in that class that um, that actually, like, psychologists and other memory type specialists are actually um, doing more work, and there's more science going towards it than even the medical field in that regard. So it's like I felt like there was this other option for me from that standpoint, where I could go in and I could learn a little bit more about psychology. I just loved it. I loved learning about the brain. It made a lot of sense, and it was something concrete for me, rather than all this pie in the sky. Like, I'm learning about organic chemistry, and I mean all these things that I don't give a flip about, right? So it just for me, it just kind of clicked, and so I started looking up different programs and different things to get into, and I was like, man, I'm going in the psychology field.
So you got your undergrad, so bachelor's degree. Now, at the time you graduated, you didn't have to have a master's to actually do it. Is it correct that you have to have a master's degree to be a therapist now, or no? Or did I miss?
Well, it depends on the type, right?
Okay.
In the state of Oklahoma, a licensed professional counselor is somebody that does have a master's degree in a relative field.
Okay.
And that's the route that I ended up choosing.
And you always had to have that, or would that recently change?
It's been pretty consistent for the last few decades, but really,
okay. For some reason, I thought that just changed for some reason.
Well, I mean, you can do a lot of good with a bachelor's in social work or a bachelor's in psychology, something else in the mental health field. That you can do a lot of really good work. You can get your hands really dirty and really get in there in the community and make a lot of good. In order to do therapy, that's where you're going to need the master's degree.
Okay.
And so I didn't want to stop with the bachelor's. I always wanted to do secondary education. I originally thought I was going to get my doctorate.
Oh, wow.
But once I got into the field with my master's, I haven't had to explore that, because I've been very fulfilled and continue to have my career grow with the agency I'm with, Grand Mental Health. I've continued to have that move in the right direction, so I've never felt the need to have to go back to school.
And so you got your undergraduate degree at Oklahoma State University, right?
Yep.
Yeah, you went to OSU Stillwater.
Absolutely.
What do you think about OSU?
I loved it at the time. I look back and I think I'm not sure that I want my kids to go there, right? Because
Matt, they'll be fine.
So you were there as well.
So. No. I already had a kid, so I lost that opportunity to go to a state school. So I went to OSU Tulsa. Because I was working, because I decided at my junior college to get a associate's degree and a 1-year-old. Okay. So yeah, that's what
earned.
Yeah. So, but Rylan is now 12. Gosh,
and awesome.
A teenager.
Yeah.
About to be a teenager. But yeah, so
just finished 6th grade.
Yep. Just finished. Going to be going to 7th grade. So yeah, just crazy. But yeah, so I didn't get to go to a state school. I went to junior college, NOC Tonkawa, Northern Oklahoma College, Tonkawa. Shout out. I don't even know what the mascot is. I don't even know what the mascot is. And then I went to OSU Tulsa. But
okay,
yeah,
that makes sense. I knew you had been at OSU.
Yeah, I'm a Cowboy fan, unfortunately, because they disappoint me a lot.
It's the best way. Like we talk about, you hear a lot in religion about like the suffering model of like being comforted by your suffering type deal, and it's kind of like that with being a Cowboys fan.
And then we just had the Thunder game too.
We're so close, and then Thunder, it's tough, but we make it.
Yeah, it's tough to be an Oklahoma fan right now, but thank goodness. Actually, I'm kind of upset that OU is going to the SEC.
Yeah.
I'm gonna miss that. A lot of good rivalry there. But so you went to Oklahoma State University. You liked it, but kind of thinking about not letting your kids go there because it is a
I
great
don't know.
school.
I don't think there was as much focus on education. It could definitely be
Oh
different
no,
now.
100%, dude. It was a party school, man. I loved
Everybody's
it.
experience is completely different. I just
Where would you want your kids to go?
I want,
Harvard?
well, yeah, I mean, duh. I mean, yes, absolutely. But Ivy League for sure. No,
Yeah.
I don't think it really necessarily matters to me. I want them to find the right program before they go in. You can always change your mind later. You can always transfer schools. It doesn't necessarily matter to me.
Would you be cool if Sawyer went to a technical college?
Sure.
Wanted to be a plumber?
If that,
honestly, if like, I think that's like a smart way to go.
Yeah.
Like, I mean, if you have no desire to go to a 4-year degree for, whatever higher education, and you're like, hey,
listen, I've always been jealous. Shout out my brother-in-law. He's got all the toys, man. And he's a plumber by trade.
Oh, Haley's brother?
Yeah.
I didn't know he was a plumber.
Yeah. Yeah. Alex.
And he went straight from high school?
Straight from high school, went directly into a trade.
So smart.
And yes, he's had a great career, makes great money. He always has the cool toys, the razor and all that
Good
stuff.
for him.
Yeah.
Does he live in Kearney?
I think he recently just moved to kind of the Norman area.
Oh, okay, Norman. Is Kearney close to Norman?
It's closer than here for sure.
Okay. Yeah, because I knew Haley grew up there. I just never really pinpointed on a map, so I don't know exactly where it's at. But cool. So you got your undergrad at OSU, then you got your master's in Missouri?
Yes. So I went to a professional psychology school. It's called Forest Institute.
Mm-hmm.
I went there. They had a thriving doctorate program. I went there to be a neuropsychologist. Was what I was going for. I went there, and the first semester that I was there, the school got put on probation by the American Psychological Association.
Oh no!
So it just started crumbling, and so I had a chance to get out of there within 2 years with my master's, and so I took it.
Okay, But if that all wasn't happening, you were still going to go get your PhD there. If all that stuff wasn't happening,
it's actually a PsyD. It's a doctorate of psychology, and that's part of the issue. Is the field itself is very driven by research, right?
Right.
And the PsyD gives you the ability to become a psychologist without having to do as much of the research piece. And that's a lot of the APA. They have they take issue with some of those programs, and they just didn't like some of the dissertations and thesis that were coming out of that school. They didn't feel like was the quality that that the field should be asking. But they ended up they worked through it. They got off of probation and all of that, but the school just didn't survive it.
So what would you have done if you got your doctorates? Like, what do you do with that degree, like a neuroscience psychologist?
So I was going to do testing, and I was going to work with individuals with memory struggles.
Oh, okay.
So that was kind of the idea. I'm still able to kind of scratch.
So you weren't going
to
do research. You weren't going to get your PhD to do research.
No.
You're okay.
No.
Okay.
No. I was going to that PsyD school. They had a professor there at the time that was a specialist in. He was working at the forensic center there in Springfield, Missouri, and doing a lot of neuropsych work.
Okay.
And so I was really intrigued by that. I thought it was what I was wanting to do with my career. I still get to scratch the itch now. I work, I'm a coalition member with the Behavioral Health Forum on Aging, and I'm a member of the CCBHC task force. And so I'm helping right now to help create age-friendly businesses in the state of Oklahoma.
What is that?
Interesting, right?
Age-friendly businesses?
Yes. So imagine if someone who is aging could come into your place of business or your place of treatment, let's say, if it's the healthcare field, and they could feel fully comfortable. You met all of their needs. So like little things like just access, just
Mhm.
the way that you open a door in some places may be more difficult than others. The way that the seating is, just little things you don't even think about, like just armrests. So if you're someone where your age is somewhere, let's say, I mean, it's difficult to go off of age, but 60 plus, it's more comfortable for you to sit in a chair with armrests and also get up and back down out of that chair. And so just little things like that. So we're working on different credentials and different trainings that businesses could take to kind of wear that sigil of like, we're an age friendly place of business.
That's interesting. So it's almost like a is it ADA? Is it what's the one for
ADA compliance?
ADA compliance.
Mm-hmm.
So like, having, the things in one of the bathroom stalls. So
and that's a big part of it. And I focus really heavily on some of the physical stuff, but it also really involves the how informed you are as well. So for instance, I took a webinar yesterday over the cafe model. So
like it's a cafe, like a restaurant cafe?
kind of like a restaurant. So it's having the ability to, you put on this almost like event or this cafe group deal, and you give it a topic. So you can have an aging cafe, right? And it's for people that are going through struggles that you typically would if you are going through the aging process, right? And it gives them a time to talk and ask questions to each other and to grow and make their experience better through doing it together with other people. And so one of the interesting things they talk about was a death cafe. And so I hear death cafe, and I'm like, that that seems kind of scary, right? Like, or maybe there's going to be death metal playing in the background, or like, like that's where I'm headed. But a death cafe is a safe place to talk about what death looks like or feels like, and so being in a position where
talks at that?
It's really interesting. There's no general topics. There's no agendas. You just come together as a group of people who are interested in a safe place to discuss death and dying and
that's crazy. So it's like a support group.
Yeah, it's a support group model, and
so that's what the aging. What did you call it that you're working on?
It's the Behavioral Health Forum on Aging.
Okay,
yeah, it's put on by the Department of Mental Health here in Oklahoma. We meet once a quarter in Oklahoma City.
Okay, interesting. So when you got out of college, you went straight into. You only worked at one place, right? Or did you work at another place before you went?
I've worked at a couple other.
Oh, have you? Okay.
Yeah, I've spent the majority of my career. I had a wonderful job that I loved. I really got into community mental health in Muskogee. So our Green Country folks, love you guys.
Shout out Muskogee.
Miss you. I wasn't there for very long because I was driving from Owasso, and that was back whenever it was like $4.50 a gallon for gas.
Oh my!
So we're talking like 11 years ago,
Yeah.
And so it was just eating us up, right?
Yeah.
And
from Owasso to Muskogee, that's.
So I got a job.
2 hours.
I did basically the same thing, but I got a job for a different company in Claremore, and that's the story of how I started at Grand.
Okay, so you were at Muskogee first, and then you went to Grand. And
I did a couple other things. I was working kind of in Tulsa. That was my first therapist job, though.
And you were actually talking to clients, sitting down with them in the long chair with your.
The beginning of my therapy career. Yeah.
Okay, and so you went to a company called Grand Lake Mental Health, which it's not Grand Lake anymore. But can you tell me kind of the backstory behind that? Because I think it's kind of interesting how that.
Right. So Grand Lake started in the Grand Lake area. So they were providing services. It's a huge, for those that don't know, it's a huge lake in Oklahoma. It's the northeastern part of the state, and there's multiple counties and cities that surround it. And so they started providing I believe the original company, it was Grand Gateway. And so they started providing services kind of under that umbrella. Mm-hmm. And so they went with Grand Lake Mental Health as the name and got the services started. Well, we became a CCBHC, so that's a Certified Community Behavioral Health Clinic. In 2017, we were one of the first 3 in Oklahoma to don that title. It's a federal Medicaid program.
And real quick, when did you start with Grand?
I started with Grand in 2013.
Okay,
so
2013.
August
Okay.
of 2013.
And how many clinics did they have at that point?
They had, well, we'll just look at it as kind of like counties. They had 7 counties.
Okay.
And so some of them had a couple different clinics in it, but in 7 counties. So
in 2016, you became a...
Right. We 2017, and we took over at that time. We had been established in some other counties, providing some a different. It's no longer around, but it's called Health Home. It's where we were focusing on providing information on putting the mind as a piece of it, but also focusing on the body. So providing like care coordination for like doctor's appointments and stuff like that, like working with the individuals we were serving to make sure their physical health matters were taken care of. So we started doing that in some other counties, and the contract with the Department of Mental Health to be a certified community mental health center came open. And so we applied for it and got it. And so we expanded to 5 other counties. So we're providing services all the way over to like Ponca City. And
you guys are in PC?
Oh yeah.
That's old stomping grounds. They need it. I'm just kidding. I'm just kidding. I grew up there, once graduated high school there.
Blackwell, Perry. We're out in Perry. And so we're providing all these services out here, and people are like, Grand Lake, what, what's a Grand Lake?
Yeah, what's a Grand Lake?
So they end up, we went through a rebranding a few years back, and we're now Grand Mental Health because and now we've even moved into Tulsa. We have the CCBHC contract here in Tulsa now. And so
and you guys are doing a lot of other things, which we'll talk about, 12 and 12, you guys taking that over and being in different school districts and things like that.
Yeah, we merged with 12 and 12. It's pretty cool.
Yeah. So when you first started with Grand Mental Health, and that's right, Grand Mental Health, right?
It's Grand Mental Health.
Grand Mental Health.
You got it.
Yep. So you started just as a therapist, right? And this was in 2013.
Yeah. So at the time, my title was a behavioral health professional, and basically that's a fancy name for a therapist. And so at the time I wasn't licensed. I didn't have my license to provide therapy. I was what they call under supervision. So in order to become a therapist, you spend a couple years working under a therapist. You have a clinical supervisor. And so I had spent those first couple years working underneath a clinical supervisor.
So right when you get your...
Shout out Dan Curtis.
Dan Curtis, shout out to you.
He's the man.
You just made one of the best therapists in Oklahoma. No, I'm not the best therapist. Yes, you are. You're great. You're awesome. You're the best. So you after you get your master's degree, you don't become a therapist. You got to get some like hours.
There's a lot that goes into it.
Okay,
you have to pass a test, which is pretty grueling. A couple tests. You have to get experience hours and working underneath, and you have to, the whole time you're working under someone else's license. So it's a difficult process to go through and fully get your license.
I did not know that.
I got lucky. It only took me a couple of years. Some people spend a little bit longer on it. So yeah.
Wow. And so you're doing the therapy, but you moved up in the company.
Yeah. So I fell in love with what we were doing. Like I started just getting it, man. So we do this thing called collaborative documentation, and it's where you document the session with the client while they're in the session with you. So like I would finish a therapy session and I'd be completely done with all my notes and everything. And so I'd go up to the front and start another therapy session. Like if my person no-showed me or wasn't there, or they needed help up at the front, or someone new came in, like I'd just grab them, like, let's go, let's talk. Like I really, really liked it. And so, I started getting I was recognized. There were some company-wide emails that came out, like top billers for the month and stuff. And it just, my billing, my productivity kept going up, and I just was having a blast. I'm leaving at 5:05 every day with all my paperwork done and get to just spend time with my young family, and it was really rocking. And some opportunities came available to be, at the time we called it an administrator.
Right.
And I just started shooting my shot and applying for those jobs, and I got one in Bartlesville. So good old Washington County.
Yeah, Beeville.
And then after I got that job, I found out with the announcement that they sent out to the company that it said Washington and Osage County. So I didn't know that Osage County came with it until the announcement came out. But yeah, well, listen, it was fine. It was short lived. They needed their own designated person over there.
So with Grand Mental Health, you don't. Let's say I couldn't afford health care or seeing a therapist. Could I still come to Grand Mental Health?
You can get help for your mental health in Oklahoma, regardless of your ability to pay.
Okay.
So we are really close partners with the Department of Mental Health here in Oklahoma, and we will get you help regardless of your insurance status. So literally the most difficult thing for us to do in providing you with help is if you do have the resources and we're just not in network for those resources, right? Because in that way, what we would do is we just help you find a place that is in network for your
So if I don't have insurance,
yep,
and I don't have money, I can come into your place and get help.
Absolutely. We specialize in that kind of that Medicaid model. So like we're working really closely with the managed care organizations that have come in and are taking over what people view as like the traditional like sooner care, you know? And so we're working with that model to be able to provide those individuals with a bevy of care and resources. So we're focusing on the individual that's in front of us and getting outcomes for that individual. So they come in, they're struggling with depression, we want their depression to get better. But we also are asking questions about what are your resources, right? Like, where are you laying your head at night? You know, and if there's an issue with housing, we're making referrals for housing. If they are struggling to be able to work, we're making referrals to be able to, and a lot of these are internal programs to be able to work with, the IPS model, which is a model for working, helping people getting back to work, you know, who've struggled with mental illness. So.
And this is something else that I really liked about Grand Mental Health, because here in Oklahoma, we have two big metropolitan areas, right? We have Oklahoma City and then we have Tulsa. So a lot of Oklahoma is rural.
Yep.
A lot of small rural cities, towns, all that stuff that don't have a lot of care for healthcare. Because if you look at Oklahoma as a whole, we're lacking in healthcare, right?
Yep.
Hospitals, mental health, whatever, clinics. But when you look at Oklahoma City and Tulsa, we have a lot of healthcare, options, comparatively to the rest of the state. So Grand Mental Health originated and has offices in a lot of rural towns and cities. I mean, do you guys have, other than Tulsa, it's all rural, right?
Yeah, we have, we're kind of like, it's kind of like Dollar General. You kind of lose like where your locations are, but no, not really. But, we've got over 30 locations throughout the state. We're primarily in north central Oklahoma. It spans all the way from the top, all the way over, till you get to, the Joplin area. We stop there once you end in Oklahoma, but we're in all those north central, east counties.
Where are some others? Because you said Blackwell, that was one of the small ones.
So those. So like Miami and Afton.
You got one in Afton?
Yep.
That's tiny.
Yep. And we have we have locations. Our Afton location provides. It's really interesting. They primarily provide services to residential care facilities. So these are individuals that are they're placed in a spot where they can get the intensive care that they need for their mental health or a different disability, and so it's kind of cool that we get to work with that population too. But yeah, we're all over the place. You name it. Claremore, Bartlesville, Nowata. We're in Jay and Grove. We have an office in Little Kansas, Oklahoma. So yeah.
That's actually its town, Little Kansas.
Well, yeah, Kansas, Oklahoma. We call it
Oh.
Little Kansas. Yeah.
Yeah, see, because I thought that was really cool because you told me you're driving one time when we were out, in the sauna. You're like, oh yeah, I got to go to so and so town, and I was like, you guys have a clinic there too? And you're like, yeah, we got all of it.
I've done so. But before this last, before I became the chief clinical officer, I was a regional officer. I was an adult services director at one point where I was over all the counties. So I have done some driving in Oklahoma. I've done the back road driving. I've been to a ton of clinics. I used to do a lot of driving for sure.
Yeah, and so you said it, chief clinical officer. Now you started off as a therapist. Mm-hmm. And worked your way all the way up to a chief clinical officer, which if you don't know what that's part of the leadership team of Grand Mental Health.
I'm on the leadership or the executive team at Grand Mental Health.
Yeah. So what do you do now as a chief clinical officer?
It is a lot of fun. So
I don't know if you're being sarcastic.
Basically, no. So here's the thing. I love it. I absolutely am having a blast at it. The way that I described it whenever I first started is it's kind of like, imagine that you are controlling a puppet that is spinning plates. So you're not the person that's spinning the plates, right? You don't have that control. You're controlling the puppet that's spinning the plates, right? So there's a ton of tasks every single day. And obviously one person is not able to take on all of those tasks, right? So I view my responsibility as making sure that we're providing fantastic, the best clinical services that we can in the counties that we serve. And I have to do that in a way to where I am utilizing my resources, right? So, working really hard with the team that I have. I work closely with the clinical directors that are in the clinic and our regional officers who are now they're the ones doing the majority of the traveling, and just being in a place to where I can work and focus on protocol, care pathway, just ensuring that the care that we're providing is to the utmost standard, not only for our state, but nationally, and and even worldwide too. We look at other models across the world. And so I focus really heavily on that. And we focus on models that'll work in our clinics. And then I'm able to pass the task. And I can't forget the task, and I got to follow back up with the task. But yeah, so that's kind of what it's like being a chief clinical officer.
Man, that's pretty cool. That's pretty cool because you're right up there with the CEO and COO and in meetings with them. So pretty cool it's a pretty cool story that you started from what's that song? You started from the bottom, now we're here. Started from the bottom, now we're at the top.
Is that Drake? Who sings that?
Is that Drake or? Do you guys know? Is that Drake or is it Drake? Okay. Drake. I thought it was 50 Cent or something, but no, okay. I don't listen to much rap. Yeah. So
I think you made her cringe.
What? The Poop Podcast. So much cringe. You heard me singing before.
I was the original cringer though, so I started the cringe.
Oh my gosh, am I like a dad now?
Yeah,
we're just
we're old.
Sarah, how old are you?
Okay.
Oh, what? I mean,
she still has some life.
Oh. So on the Grand Mental Health, you guys took over 12 on 12. So that's some of the things that.
Yeah. So we did we helped them out. So it started out with there was a little bit of struggle because statewide we needed more beds available for residential substance use treatment.
Yeah. So for example, backtrack just a second. So 12 on 12 is a rehab facility,
right,
for addiction. Right. And it's based in Tulsa. So in case you didn't know.
And so, I mean, it's a historic facility. They've done such great good for the city of Tulsa for years and years and years. So we came in to help, and throughout that process, we just, we found that the grand model is also it works with substance use as well. And so we worked closely with them, and we merged as a company. And whenever that happened, we took on a lot of the same staff, and we kind of used our model and kept a lot of the good things that they were doing alive. And so it's kind of cool because it's now our addiction recovery center is what we refer to the building.
Is that what it's called?
Space. Yeah, the addiction
recovery center. So it's not called
center.
12 and 12 anymore?
It's not 12 and 12 anymore.
So was it called Tulsa Addiction?
It's the Addiction Recovery Center.
Oh, Addiction Recovery Center. So if you want to Google it, you type in Addiction Recovery Center in Tulsa, and then that should pop up. Okay.
Yep. And so, but it still has that heart that it has before. So it's really important to us for it to keep the heart and the positivity that it was bringing the community is still there. We've just added some extra zest and in that model that we worked so hard on perfecting in our other 12
So it's
counties.
still 30 days and it's co-ed, right? Is it co-ed?
Yes, absolutely. Yeah, we do both.
And then it's 30 days, and then it's free, right? Or how's that work?
So we actually at the Addiction Recovery Center at this time we don't take insurance, right? So it's either you are on Sooner Select or receiving you're on Medicaid, or the Department of Mental Health is helping to provide that support for to cover your stay.
Okay.
So it's an awesome program. It starts out, we look to try to get the job done, get there, provide a lot of intensive treatment over the course of 30 days, and see if we can get you back out into the community. We've had a lot of luck with now that we have grown and we've established like outpatient teams there, and we're now a certified community behavioral health clinic in Tulsa. We now have been able to expand our team, and we're to the position now to where we're providing those outpatient services as well. So it's a connection, right? It's all about we call it the continuity of care. So someone comes in, they're at the rock bottom, right? Whenever you're done with rehab, that's not the end of your journey, right?
No.
So we are able to connect you to an outpatient team that continues the journey, and from there.
So, and that's so important, because as an alcoholic that's been through rehab, and that's just to get you back to a what's that word? Like back
stabilized.
To stabilize or whatever. There's a better word for it, but I forgot. But it gets you basically stabilized, and then really the work is done after rehab. I mean, because you're basically getting back to regular life. The best way I described going to rehab for me, someone asked me, is like you're on a merry-go-round before you go into rehab. You're on a merry-go-round that's going 100 miles per hour, right? And what rehab does is it basically gets you an opportunity to get off that merry-go-round and slow it down. It doesn't stop though. It keeps it going. So basically getting off, going to rehab, it's getting off the merry-go-round. But when you get out of rehab, that merry-go-round hasn't fully stopped. It's still going. So how do you get back on the merry-go-round, and how do you stabilize the merry-go-round? And that's important with, going to, meetings or talking to a therapist continually, and not just completely stopping.
And we utilize the recovery support model. Mm-hmm. So we each individual who's an adult, and this is actually soon going to be unveiled for families too. They'll have a family recovery support specialist, but we have a recovery support specialist for each of our adult clients that come in. You're assigned to, and this is an individual with lived experience. So this is somebody that has a recovery of their own. Some of them, it's a recovery from depression or anxiety, but a lot of them have been through they've been through substance use issues themselves, or trauma, and so they have their own ways that they were able to make it from point A to point B, and to be able to work in a profession where you're now helping the individuals who are struggling like you once were. And so we utilize that model. And so to give people hope, right? They're kind of our hope ambassadors is a term we really like to use. And so it's more than just coming in and getting therapy, staying on medication. Whenever you look at the outpatient lens, it's getting connected to a team of people that will work to help you make sure that your needs are continuing to be met.
So other than 12 on 12, you guys are actually teamed up with all schools or just some schools?
We're in some schools in the Tulsa area. Yeah.
Yeah, because I remember there was a student from a small community passed away, and then recently Owasso, we had an incident where a student lost her life, and was not good. But so you guys provide access to?
Yeah, so we're doing outpatient care in a lot of the schools in the area, specifically like in our 12 counties. We're in a ton of them. We have staff that are dedicated to work in the schools. So we have a role that's referred to as a behavioral health coach, or the certification they go through as a behavioral health aide. They are there to help provide behavioral health support to the school. So it's kind of this cool, like you have 1 foot in the school and 1 foot in the mental health world, right? And so they help the schools with making sure that their behavioral health needs are met. We've got like 140 behavioral health coaches throughout the state of Oklahoma. So we've got a lot of support. We're also providing that to some of the schools here in Tulsa, and it's just great. And so that provides you that direct link to somebody that knows what they're doing in the schools. We'll provide extra support to the community at any time that there's a natural disaster, a death. We focused really hard in Owasso to make sure that we're checking up on the school,
right?
Offering extra support. We sent extra therapists up to the high school and some of the other schools there. After they were grieving and going through that loss. We provided support in Barnsdall most recently.
Yeah, which you got hit by a tornado.
Yes. So just being there to provide debriefing, being a person that you can talk to whenever you're going through something that's really difficult and tragic is important. And so, we just try to do our best to fill those voids as well.
Yeah. Absolutely. And I think mental health is, I think through Grand Mental, you guys have been doing a great job of like leading the charge on that. And you told me that a couple of other states have actually reached out to Grand Mental Health to help them.
Yeah. We've worked with many different states to try to help as well. South Carolina, North Carolina, Alabama, Georgia. The list goes on.
Yeah, list goes on and on. And so, what are some? Also, you guys, before I get to that, because you guys were kind of leading the charge on this too, is like your therapists get like a mental health day. Is that correct? Did I say that? Mental health day?
Yes. So that's another thing so we focus really,
as an organization,
right?
Too.
We focus really heavily on 3 things as an executive team. We want the client experience to be phenomenal. We want the staff experience to be phenomenal, and we want the community experience, our community partners, to have a phenomenal experience of the mental health support they're receiving. So, for instance, if you work at Grand Mental Health, you have a $10 copay for any behavioral health treatment you receive. So, out of network, in network, if you need therapy, you're going to be able to go for $10 a session. So wow. It's pretty sweet. We also take care of our employees by, we have other initiatives and things, but one of the coolest things we do is we do a wellness day. So this is 26 days a year that it's just extra time off, right? So we do every other Friday. Some roles, they do it on Monday. It kind of depends. A lot of our court teams will meet on Fridays, so we have them utilize Monday as their day. But every other Friday, our staff, our outpatient staff, are given the ability to just take off that day, right? Just worry about your own wellness. And do
you get every other Friday off?
I do not. But
dude, you're making these things and you don't benefit from them.
So our directors and up, here's the thing, and listen, I'll say it to whoever wants to hear it. I think we should have wellness days too. But
don't you make the decision?
right, well, I'm a part of the decision,
Oh,
right?
okay.
But I it's it's one of those things where we want to make sure that you can't sacrifice any of those three experiences
Right.
too much, or you're in a place to where they'll all falter. And so in order to have a good clinician experience, we have to make sure the client experience is still good. And so if all the leadership is out on a Friday, or every other Friday, whatever, then we may be in a position to where that client experience or community experience declines. So you have to have a good balance.
Right.
But we've seen phenomenal outcomes with the mental health services we're providing. We take the teams. So each outpatient client is assigned we refer to them as integrated team managers. That's our therapist role. They're managing the outcomes of each client. They are assigned a care coordinator or a case manager. Those individuals are helping with needs and providing that care coordination for physical health, community resources, and then also the individual's lived experience. And so with those three roles, what you're looking at is you either will have one or two out on a Friday, but not all three. Okay. So a client will always have somebody that's working that day that can help them meet their needs if they have it on a Friday.
Okay, that makes sense, because I didn't even think about that.
And we also promote walking in, right? So that's something we're pretty, like, if someone ever wants to get started with services, they can just walk in. They don't have to have an appointment. And it's the same thing for our clients. If they ever have a need, they can walk in and we'll
and
get
that's
them
good
someone
too,
to help.
because I think leaving or taking down as many barriers as possible with mental health, of receiving mental health care, is super important. So if this afternoon I'm like, man, I really need to talk to somebody, to not say, hey, I'll make an appointment, we'll see you next week, or I'm I need help right now. So it's kind of nice that that you guys offer that, that they can just
you brought up kind of the rural thing. This is something that I think is pretty interesting. One of our claim to fame things that we did was and we really excelled during COVID because a lot of our clients already had iPads in their homes. So we started a program where we started doing telehealth services via iPad. And this was years before COVID, right?
Right.
And so
you guys also offered that before COVID?
Way before COVID. Way before.
That's crazy.
I'm talking, we were doing it in probably 2016, 2017, around that time frame. We gave iPads to every law enforcement, every hospital, to be able to have instant access to a mental health professional.
Wow.
And so, and get clients the help they need, So if someone was in crisis and they had an interaction with law enforcement, we gave them the option of listen, obviously you're going to have people that have committed a crime and need to go to jail and need to go through that process. But if that's not the case, then you have the ability to get that person in front of a mental health professional like that,
Man, that's pretty cool.
Yep. And that's meeting the rural need,
Yeah. So we'll wrap up with this couple questions here, but so Oklahoma as a state, Oklahoma gets a bad rap, to be honest, with a lot of things. Some people, I don't think this, but some, a lot of people from the outside, because I do move a lot of people here to Oklahoma from the from the rest of the, the country, kind of say Oklahoma is kind of like the armpit of the United States, right? Sometimes they say the other word or the other end, but I'm not going to mention that. But if you look at statistics and things like that, online of, certain categories, Oklahoma doesn't look too great. So coming from a professional that's actually boots on the ground in the industry, what does Oklahoma kind of lack in the mental health services that we could do better on?
Yeah. So I think a big part of the issues that we see involves kind of that stigma, right? So you go somewhere out to the west or east side of the country, someone's going to say to you, they're going to be like, oh, I saw my therapist yesterday and he was helping me work out all these issues, right? And so in Oklahoma, you say, oh, I'm seeing a therapist, and someone's like, oh, okay, I'm going to look the other way around, right? So that's kind of the stigma here in Oklahoma that we're faced and we're up against, and so that's something that we continue to fight. I think it's getting better, right? I will tell you, there's one area where Oklahoma is really, really exceeding a lot of other states in.
No, you're about to give me something positive.
Yeah.
I want to talk about the negative.
Okay, well, let's
talk about the positive. Let's talk about the positive.
Listen, I mean, it's just it's a part. I'm an optimist, right? We talked about it. I'm left leaning, right? I'm positive, right? Like I see the good in people. So
well, tell me the positive, because you said there's one thing that we're doing really, really well. So I do want to hear that.
Okay,
I do want to hear that.
Let's talk about it. So, we are leading the way with children's mental health, right? So the services that the kids are receiving, in the schools with the families through wraparound services where we're working very closely with the families, right? And in the schools, that is above board of what a lot of the rest of the country is doing. We're helping out many other states. I'm helping with an advocacy issue off in Rhode Island, where they're unable to get access to the schools to provide them with behavioral health support, like just little things like that, So I think that what we're going to see is, because we're ahead of the curve here, I think all of those outcomes, you have to give it a little bit of time. But I think over the next decade, 2 decades, what you're going to see is you're going to see those statistics start trading places to where Oklahoma's looking at one of the top states.
You know what? That's good, because that was kind of some of the statistics that I wanted to talk about. Was like, Oklahoma has a very high, drug, drug, women's incarceration, teen pregnancy. What are some other ones that I saw? And that's just kind of like, but by your answer of saying what we're really good at, that makes sense, because you got this, tree, that has dead leaves, but what's happening down underneath at the roots of when it's growing?
We're focusing very heavily on the trees that are growing. I love that analogy. Very good.
Yeah. I just made that up.
It was beautiful.
Dude, I should have my own podcast.
You should have your own podcast. And you should
name it The Poop.
Work out at 10 Jam and have sauna buddies.
Yeah, I think I'm going to do it.
Okay, you should.
Yeah. So what else would you, is there anything else that you would say wrapping up this podcast, of like anything that you want to say to the, many follow or listeners that we have?
Oh man, the like send off question, right? Like the pie in the sky, whatever.
When I Googled how to start a podcast, they said they need to have a send off question. So that's what I'm doing.
Well, I'll just say to be kind to everyone. Everyone's going through their own thing. And regardless of what your political beliefs are, regardless of what state you're living in, regardless of what your circumstances financially, you are an important and valuable human being. And there are people that care for you. And we're in a position, at Grand Mental Health, we're in a position at Refuge Owasso, to where we do want to help. And so those of you that are out there and you need help, come get help. We will. And if you already tried and it didn't work the first time, try it a second time, try it a third time, try it a fourth time. There will be a time where it sticks. Right. And so just for those of you that aren't struggling, which I think all of us are probably struggling with something, right?
Absolutely.
But if you're not, then be ready and be able and be present to be able to be that support for someone else, if you can.
No, absolutely. So where can they find information on Grand Mental Health? Yeah,
so go to grandmh.com. And you can learn all about Grand Mental Health. We just launched a new website. So, so you can check out my picture on there. I
looked up, awesome website, by the way, but that's where I looked up, because I forgot, you said you were on like the executive team, leadership team, but I forgot what your title was. I knew you were like,
so you found it on the website?
Yeah, I found it on the website. That's where I found it at. But cool. Awesome. Well, great. Hey, Matt, thank you so much for coming on the pod.
Awesome.
And,
wonderful.
I'll have you on again.
I will say, regardless of how I feel about the name, the title of the Poop Podcast is awesome.
Thanks. Appreciate it.